Welcome back. Dr. Alan Kiger with Amazing Spine Care joins us today, and we're focusing on back pain. There's a lot of it out there, so we have a lot to discuss. Welcome, Dr. Kiger, to Look Local.
Thank you very much. Glad to be here.
Glad to have you. Let's talk about the main goal. What you're saying is today, a lot of this back pain is because one leg, and oftentimes, is shorter than the other.
That's absolutely correct. When throughout childhood, we have our body that's trying to develop. We have our bones that are trying to develop. And as we develop early stages, we are going to have problems with asymmetry. Because we have problem with asymmetry, that's going to impact the leg length. And I'm talking about the left leg versus the right leg. So most people, 90% of the population, including children, elderly, kids, what have you, are going to have the shortness of the right leg. Okay. So once you have the shortness of the right leg, you are going to be impacted, and that would result in having low back pain.
Okay. So, and what we're looking at here, lower back pain is going to be in the lumbar area, or is it going to be even lower than that? So correct. I know where.
Your low back pain will develop in here, which is L5S1. 88% of Americans currently are suffering from the chronic disease of the low back pain. And then L4, L5 in this region, and 20% will suffer from the L3 and L2 problem in the low back. Now, also the sacroiliac joint, which is the hip joint. So once you have the shortness of that leg, you're going to put a lot more pressure on the hip joint, which will also further develop in the bursitis of the hip, or chronic hip problems with most of the populations currently combating that issue.
A lot of times that can lead to hip replacement surgery as well if it's not corrected over time. Those joints, I know, can start to really wear out. It's interesting when you're talking about this. Also, when people are in a car driving for lengths of time, oftentimes they have pain in the lower back. And nowadays, many cars have that lumbar support system. What is that? How does that work? Is it giving pressure on the lower back?
That's a very good comment that you're making, Karen, because the lumbar support is going to push out this curvature here, which will try to take your leg and push it further. So that will relieve some of that pressure that you're putting on the low back, and trying to relieve some of that disc pressure that you're having in these areas, which are causing problem into your sciatic nerve that runs down your leg.
Okay, well, there's some very valuable information. I want to get to the book that you've also authored. This is authored by Dr. Alan Kiger, if we can get a shot of this. And tell us a little bit about why you wrote this book and what it pertains to generally.
The reason why I wrote this book is for a lot of the patients that we have are suffering from the car accident impact and the injuries that are associated with it. And a lot of them have questions. Throughout 9 years of experience from ranging various states that I've been practicing, I put this book together for people to find a solution for a chronic low back pain, for chronic neck pain associated with car accident, because those injuries, they're like cancer. They do not go away. Even if you completed care, you are not taking care of your body, you are not following proper hygiene for the spine, you're going to still suffer for many, many years as a result of your injuries that you sustained in a car accident. And this is your sort of like a guide to a pain-free body once you finish your care.
This guy out here, he's like, ow, he's hurt his back. So that's the cervical area. I mean, you're talking whiplash on this guy, right?
Yes, correct. Depending what the area of injury that you're suffering from in a car accident, this is the area that we'll be focusing on in our clinics and helping people out with the exercises, with the proper nutrition plan. They can help them stay pain-free for the rest of their life.
So that's what I was going to ask you, and I guess in final thoughts, all these things sound pretty bad, but there are ways to alleviate the symptoms and rectify the problems.
Definitely, because your pain is not related to the medications you're taking. Your pain is not related to the injections that you're taking for your spine. Your pain is related to the problem that you are unable to do. So if you're having a low back pain, you are not going to see the doctor because you're having a low back pain. You are going to see the doctor because some of the things that you're unable to do, lifting your kids, going to work, unable to sleep, and etc.
Okay. And if somebody does experience some back pain from time to time, which we all do, and maybe, you know, it's something that we can get some relief from with ibuprofen or Tylenol or something like that. But if it's chronic, if it's persistent, how many days should we, you know, should this go on before we say, hey, maybe I should go to the doctor. Maybe I should go to the chiropractor like you.
That's a good question, Karen, because a lot of people have a misconception about low back pain. They think it's a self-limiting problem. Unfortunately, it's not a self-limiting problem. This problem is a chronic problem. It's a long-lasting problem. Unless you assess this problem mechanically, you will never heal from a low back pain problem.
All right, and you're located on Beach Boulevard down by Brooks Rehabilitation. The name of the business is Amazing Spine Care. Dr. Kiger, thank you so much for coming on. Enjoyed it.
Thank you so much.
A lot of
pleasure,
information.
pleasure
for us as well.
Thank you.
Coming up next, Orange Park Medical Center will be here to discuss health situations when it comes to your heart. Plus, this Friday, August the 5th, the Jacksonville Jaguars are having an official scrimmage that starts at 5:30 at Everbank Field. Don't want to miss that. We'll be right back.